Hello and welcome to the CDAO magazine interview series. I am Vasant Eswarachari, partner from Guidehouse. Today I have the pleasure of speaking with Kiran Mysore, Chief Data and Analytics Officer at Sutter Health. In Guidehouse, we are also very focused on the operating model, specifically across the ecosystem from a patient journey standpoint, in terms of where the data is. How do we focus on data which is structured and, more importantly, unstructured data in today's world? And I know you have implemented operating model 2.0. And if you can double click on the innovation that you have done from a digital front door standpoint, I think that will help the audience quite a lot.
Sure, Vasant. Maybe before I answer the question, I want to take a step back to sort of highlight Sutter Health for all our listeners. So Sutter Health is a not-for-profit health system serving more than 3.5 million patients in California. So we are in the top 10 health systems in the country, and our vision is to be the most comprehensive and integrated health system for achieving and maintaining wellness. Now, we're quite innovative. Recently, we built a large innovation center on beautiful Pier 1, overlooking the San Francisco Bay. And we have a whole team dedicated to bringing digital to life for our patients. Now, I'm going to quote Laura Wilt, who's our Chief Digital Officer. She says, digital tools can be a catalyst for transforming how we connect with and care for each patient. We are thoughtfully adopting technologies that amplify human capabilities to make every aspect of healthcare more seamless and personal. I think this is a great quote. Just like clinicians, patients often turn to digital tools to help them with discrete tasks. So with one click, right, patients want to book an appointment, look up lab results, find a doctor. And Sutter's investments in enhancing our website, our patient portals, we call it My Health Online, virtual real-time chat assistants, they've made all these clicks really easy to find and act on this year. So by expanding the use of digital tools, we are creating a more seamless, personalized experience for our patients. And then understanding and meeting the expectations of our patients really allows us to build meaningful, connected relationships that help people get and stay well. So in 2024, last year, patients embraced a record number of Sutter's self-service features, from video visits to secure messages to prescription refill requests. And as we look ahead, we are starting to take advantage of healthcare's transition as well. Healthcare is also transitioning from episodic reactive care to continuous proactive support. And in the year ahead, we are going to introduce a lot of new digital care delivery models, right, for managing chronic conditions like high blood pressure, diabetes, and so on. So this is exciting as we take advantage of some of the digital tools combined with a great dedicated care team whenever needed. We can make the right adjustments for our patients and create a very seamless, connected approach to improving health outcomes.
Yeah, this is, I think, the way I have seen Sutter evolve from an operating model 1.0 to a 2.0 is fascinating. I think that's a journey that you have been able to actually evangelize within Sutter, and I think the benefits are being seen by the clinical staff as well as the admin side of the equation as well. And I think this also focuses on the whole GenAI piece. Can you talk about how it has helped reduce the admin burden for clinicians, and what is the measurable impact that you have seen so far? I know it's an ongoing journey, but at this moment, from your crystal ball, where do you see this at this for Sutter?
Sure, Vasant. And I want to sort of also acknowledge this is a team effort. There's a lot of great folks involved in making all of this happen. So the first example I will give is around ambient documentation. So you're talking to your physician about your health. The doctor is actually listening to you, right? They're not taking notes. They're not sitting with their back to you. They're not distracted with other items, right? They're actually listening to you with the assurance that the conversation is being captured at a medical, professional grade level, right? Ready for you when you're done. So at Sutter, we actually deployed this capability. It's called ambient listening, ambient documentation, for about 2,000 physicians. And we recently published a study in the JAMA Network Open, which was great, a great recognition of the measurement and the results that we're seeing. So clinicians actually using this have reduced their documentation time by more than 15%. And that's huge. I mean, think about 15% of time in a day that can actually be freed up to see more patients or to even reduce cognitive burden that they have. And that, speaking of cognitive burden, burnout is a key thing that clinicians face. And we saw a 17% reduction in burnout. And we did this as a proper study. So the ambient listening is a great example of using digital and generative AI to really transform a patient experience. Another example, right? We built a tool called Augmented Response Technology. It's called ART to help clinicians respond to patient messages. Now, physicians get a lot of different emails, right, from their patients. Refill my prescription, reschedule my appointment. Can I see you then? Talk about this topic in my next visit, and so on and so forth. But we're using GenAI to really predetermine or pre-write the answers to some of these questions for the physician to then edit and then send right off. So at the end of 2024, we had more than 1,000 Sutter physicians using this, and we saw nearly 100,000 messages sent. And so think about all of the cognitive burden savings and efficiency and ease that we are giving our physicians as they do their work. So again, looking at all of the sort of input metrics and output metrics, we're starting to see a reduction in cognitive burden, mental fatigue, making them more efficient, more satisfied, more effective as well. So this is one example of how we're helping make healthcare better.
Thank you, Kiran, for joining us today. For more interviews and insights, please visit cdomagazine.tech.